Thank you so much for joining us this evening for our monthly town hall for the Pride Center of Staten Island. Today, we'll be going over the COVID and vaccine updates that we have available, along with raising up voices of our guest speakers this evening. Tonight's theme is more focused on the BIPOC population, or the Black, Indigenous, people of color population. And that would include how the COVID and the vaccination plans are going for this group, how it's impacting them, how they're being supported. Tonight, we're going to hear firsthand experiences from our guest speakers tonight. And tonight, we'll also be hearing the voice of Arthur Charles, our community educator at the Pride Center of Staten Island, who will guide us through this talk today.
Thank you so much, Asia.
You're welcome.
Good evening, everyone. So before we get to our wonderful speakers, I just want to kind of, as Asia pointed out, our agenda, get through some of the kind of informational piece of our agenda. Numbers and impact, we always like to be transparent in sharing this information with everybody. For this current week on Staten Island, we are looking at about an average of 3,000 tests a day, with about 10% of those resulting in positive. I'm going to share that with you really quickly. So this is information that you can readily find online, and we can share that link with anybody who's interested, and we will send it out to folks who have joined us afterwards in email. But these trackers exist for every county, and so Staten Island is refreshing as we speak, apparently. So we're looking at, like I said, roughly 3,000 tests a day are happening on Staten Island, and we're seeing about 200 to 300 positives, and that was with a snowstorm this week. So those numbers are actually a little lower than weeks previous. But totally speaking, Staten Island has had almost 52,000 positives. So considering we have a population of roughly 500,000, that's significant, and something we've seen increasing, unfortunately. So it's really important that we're still spreading the same messages about prevention as we talk to our neighbors and loved ones. Because we were trying to raise voices to the BIPOC experience, one of the things we want to highlight also when talking about statistics and numbers and impact, since the release of the vaccine, here's some racial and ethnic breakdowns of people that are vaccinated. On the left are folks who've had at least the first dose, whereas folks on the right are who have had both doses. Again, in both categories, we're seeing that white, non-Hispanic individuals exponentially lead the way for folks who have accessed this vaccine. And Asia was going to offer some insights as to why we think that might be happening, sort of editorializing on it, as it were.
As our guest speakers will be able to get more involved in some of the reasonings behind why these numbers are so disproportionate. As we have heard over and over again through our media streams, as you might have also heard amongst your own kitchen tables, there's a lot of hesitancy around receiving the vaccine if you are eligible, based on the historical negative impacts that the healthcare community has had on Black and Brown individuals. So that is really one of the #1 reasons that comes to the fore of why these numbers are looking so disproportionate.
Thank you for that, Asia. And also to piggyback onto this, as a Pride Center, we're always looking at the experiences of queer folks in the medical system. And unfortunately, that data has not been captured. What we do know from our own research and the work we do, before the pandemic, 70% of LGBT folks felt inadequately served by the medical system. So we can only imagine that has trickled down into the way that COVID is handled, unfortunately. So I hope that someone's going to capture that information, but as of right now, there is no readily available information on how LGBT folks are accessing care, testing, etc. Our always reminder, if you've been to our other town halls, we say this ad nauseum, and we'll continue to say it ad nauseum. Obviously, your safety is for you, but it's also for your community. So remember to reduce the spread before and after you get vaccinated. So getting vaccinated still requires that folks take the same precautions: wearing masks, keeping your hands out of your face, away from your mouth and nose, washing your hands, sanitizing your hands regularly, and avoiding large crowds. A vaccination does not enable you to spread this virus currently. So it only prevents you from being able to get infected yourself. I'm going to share a brief video, a 2-minute video that gives some general facts per the Department of Health.
I'm Dr. Dave Choksi, the city's doctor, bringing you the facts about COVID-19 vaccines. The vaccines are safe and will help protect us and others from COVID-19. Put simply, they will save lives. There are currently 2 COVID-19 vaccines, Pfizer and Moderna, that have been authorized for emergency use by the U.S. Food and Drug Administration, or FDA. The COVID-19 vaccines have gone through clinical studies involving tens of thousands of people of various ages, races, and ethnicities. The results from those studies were reviewed by the FDA and independent scientists, and the vaccines were found to be safe. The vaccines offer strong protection against COVID-19, particularly against severe illness. The science showed that the vaccines were more than 94% effective after completing both doses. You cannot get COVID-19 from a vaccine. The vaccines do not contain the virus. They teach your body's immune system how to fight the virus when you are exposed to it. Some people get side effects after the first or second dose of the vaccine. This is expected and means your immune system is responding to the vaccine. Common side effects include soreness in the arm where the shot was given, tiredness, or a headache. Some New Yorkers who are at increased risk, such as healthcare workers, have already started to get vaccinated. And when there is more supply of the vaccines, New Yorkers age 16 or older will be able to get a COVID-19 vaccine where they usually get vaccinated, such as at doctor's offices, urgent care centers, or pharmacies. To learn more, visit nyc.gov/COVID vaccine, call 311, or talk to your healthcare provider.
So again, sort of a summary of the safety and efficacy of the vaccine as it currently exists. To break that down a little further, when we talk about who can get vaccinated, because it is more than just being 16 and over, unfortunately, the way it is being rolled out. In New York, the way it is being rolled out, we are currently in the midst of phase 1B. While folks who fall under phase 1A, healthcare workers and residents and staff in nursing homes and other select NY state operated facilities are still eligible to get vaccinated, should they have not gotten so already. We are in phase 1B, which includes people 65 years and older, frontline essential workers, which at the original rollout was defined as teachers, education workers, childcare staff, first responders, public safety workers, and public transit workers, correction staff, and grocery workers. As of February 2nd, the definition includes now New York City taxi limousine commission drivers, restaurant workers. Rolling out phase 1B further for next week, it was announced this weekend that February 15th will be the beginning of the next part of phase 1B that will include folks who have a comorbidity of cancer, chronic kidney disease, pulmonary disease, intellectual and developmental disabilities, including Down syndrome, heart conditions, including but not limited to heart failure, coronary artery disease, cardiomyopathies, or hypertensions, immunocompromised individuals, folks who obesity, medically defined obesity, pregnancy, sickle cell disease or thalassemia, type 1 or type 2 diabetes, cerebrovascular disease, neurological conditions, and liver disease. So this has significantly opened up what we consider medically necessary folks who are eligible for the vaccine in phase 1B, which is again what we're currently in. So if you fall into these categories, the advice seems to be to look to try to get an appointment date for your first shot after February 15th, because that's when your eligibility kicks in. So the future, as we understand it from the state, looks like this. Phase 1C will start sometime in March through April of 2021, and that'll be other risk groups and other essential workers as defined by the city. These definitions are changing rapidly. Like I said, the definitions we gave you just a minute ago came down from the governor's website over the weekend. So constantly changing. That's why we hold these town halls. And then hopefully by summer, phase 2 can happen where any folks who have not otherwise fallen into an eligibility category are able to get vaccinated. So that's where we're at in terms of access. Some other general facts about the vaccine that we want to make sure we share. As was stated in the video, all New Yorkers ages 16 and older will have access to a vaccine once it is more widely available. The vaccine is free for everyone. If you have insurance, the insurance may be billed, but you will not be charged a copay or other fees. And that is not a reason you can be turned away from getting vaccinated. You do not need to share your immigration status to be vaccinated. Getting vaccinated is not a public benefit under the public charge rule, which is a concern we find with a lot of immigration folks dealing with immigration rather. And when you receive the vaccine, your privacy will be protected. There are strict laws in place to ensure confidentiality of your personal information. And we always like to share CDC information because that's the federally recognized information. Just to really reiterate this one piece of information, COVID-19 vaccines will not give you COVID-19. There is no active virus in this particular vaccine. So now that we've done our vaccine knowledge roundup, I'm gonna turn the floor over to two of my colleagues. Let me introduce them to you. We have Nicholas Robinson, who is the HIV prevention manager at the Pride Center of Staten Island. Nicholas Robinson is a Black and Latino gay cis man. He has worked as the prevention project manager at the Pride Center for the last year, helping to serve prevention needs of the LGBTQ community. He has been part of many different community organizations, both in his personal and professional life for the last decade. He is committed to fighting the stigma around HIV and to promote better health access in his community. I also want to welcome Nick's colleague, Anthony Corona. Anthony is the HIV outreach and testing specialist for the Pride Center of Staten Island. His pronouns are he, him, and his. During the past year, thanks to the pandemic, he's been doing outreach in person and virtually. He's helped many clients access home HIV test kits, which are 100% free. So if anyone's interested, he's willing to help you with that as well. And he's helped provide other services that we are able to offer at the Pride Center. Before coming to the Pride Center, Anthony worked with La Colmena, where he did case management work, and with UNICEF, where he was a fundraiser. He's currently enrolled in college where he's majoring in human services. He enjoys working with multiple communities, learning new things along the way, and being able to create positive change in communities. Welcome both of them. Thank you so much for coming to share your experiences with us.
Thank you for having us, Arthur and Asia and the Pride Center. This is a great opportunity.
Yes,
okay, Arthur, are you about to say something?
Yeah,
Sorry.
no, I got nothing. I was, I'm going to let you intro, again, your experiences, what you've been seeing out there. I certainly yield to you on this piece of the conversation. I will certainly have questions the second you start.
Got it. Anthony, if you don't mind, I'll go first. Like Arthur said, I am the HIV prevention project manager here at the Pride Center of Staten Island. My pronouns are he, him, his. I identify as a gay Black male. Cis-born male, which is a lot of different intersectionality. What I've seen a lot in the community is almost, if you ever heard of PrEP is a prevention tool that is used to help prevent HIV. And the data for PrEP that shows is almost similar to the data that Arthur actually showed us before, where our white counterparts are taking on the vaccine at a much higher rate. The same thing is happening with PrEP. So it's almost like we've been trying to help people get on board to get tested for HIV because our community has a growing rates of HIV consistently. And we still weren't able to come to make them want to get the pill or make them use a condom or do something else. Whereas now we're now trying to get them to use a vaccine. And historically, if you've ever heard of the this Tuskegee experiment or similar projects, there's many reasons why the Black and brown community do not trust a vaccine. Personally, I actually took the vaccine. I took the vaccine for a number of reasons. I have had a number of different health issues in my life, and I just figured I wanted to be on top of it for the first time. Even as a Black person, which was a little scary. I'm not gonna lie to you guys, it was a little scary. I joked with Anthony the day after I got my first vaccine shot. I was like, counting the days, so I'm a zombie. Just because in our community, that's what people think, is that you're actually going to turn into a zombie. I actually didn't want to tell anybody. And usually I'm very upfront about anything. I'll tell people I'm on PrEP. I'll tell people when I get tested. But to tell people in my own community that I got vaccinated, I was a little apprehensive because I didn't want people to look at me like, hey, there goes that guy that's going to turn into a zombie very soon. And it was really important for me now to speak about it because I do find it very important, and just for us to know that, hey, nothing has happened to me yet. My ear hasn't fallen off. I haven't turned into a zombie. After the first shot, I was very tired. After the second shot, I just had pain in my arm. And luckily, that's all the side effects I had. But I do think it's important for the community to know that it is something that we can access. I think another thing is that the community, especially the Black and brown community, we're not, because we're stuck at home or in these different jobs, we don't know that we have the access to get to get the vaccine. We don't think it's important enough. We don't think we're at that top of the list. If we're not already in healthcare or something, they're not going to give us the vaccine anytime soon. So why should I care? And here on Staten Island, especially with these high, and sorry if I'm talking too much, but with these very high numbers of COVID, we've been trying to get people for a year just to wear a mask here on the island. So we've done so much talk about getting people to just put this mask on that now we have to get the third conversation. First was trying to get them tested for HIV. Now let's get you to wear a mask for COVID. Now let's try and talk you into getting the vaccine. And I think it's a lot for a lot of people. And so right now we're just I see a whole bunch of people, especially in my gay queer life, we're all excited to get back out there. And by get back out there, I mean, we want to go hang out. We want to see our friends. A lot of us want to be a part of everything. But when I talk to my friends about this, or even community members or clients who come through, normally the people who are like, yes, I'm going to go get the vaccine to handle that, or my white clients and my white friends, my white counterparts. Whereas that my Black and brown brothers, they're just like, I think I'm gonna wait for the first or second round. I'm gonna wait a couple months. I wanna see what happens first. And I think I really wanna empower my brothers and sisters to really be the change in that conversation. Let's not wait and be the people who are left behind. Let's be the first, but that's only from my experience, because there's a lot of people who just are uncomfortable with that. I've talked enough for a sec, so I'll throw it to Anthony.
Well, I want to piggyback on some questions.
Yes.
Because
Okay.
you kind of went through everything which is incredible.
Right, I was gonna say, I have some questions.
I couldn't keep up. So I want to piggyback first to some of the work you do, obviously. So you work a lot with Black and brown men and doing prevention work around HIV and PrEP. How has the pandemic overall impacted the work you do? I'm very curious about that. So I know, again, in the queer circles I travel in, some folks have been better than others about sort of subsidizing their personal activities, I'll say, and being safe and responsible about that in ways that make sense for them. Has that made your work challenging?
It's made my work challenging in that not as many people are open to coming in to get HIV tested, which is why we have the home kits, but it's still not as many. We haven't seen as many Black and brown people getting these home kits as we've seen the white counterparts. And also I can tell you, I've seen the DOH's rules around COVID-19 and sex. I've seen the CDC, and I can tell you, we still get messages about people who need to get tested for STIs, like immediate testing for STIs, people who need immediately to get tested for HIV, which means people are still sexually active. I have found more people who are trying to have partners now. So they have just groups of people that they have sex with instead of a lot of different anonymous people, almost to build a trust. Like, hey, I trust
sex
that.
pods almost. Like
yes, like a sex pod.
Okay.
It's like,
the term I've seen used, yeah.
It's like, I trust you to tell me if you encountered somebody who had COVID, or I trust you to tell me that if you had COVID, that I should get tested. We have to on that same thing. And by us having that trust also means that also means that we're going to have this open communication, and that I'm going to make sure I'm not having sex with a whole bunch of people, and you're not going to be having sex with too many people, because we're trying to create this sex pod. But the rates, I've even been on different DOH, different trainings and just different talks, and the rates for STIs as a whole in New York City have steadily risen the whole time, which is harder now because of the access for that.
Well, that's what I was wondering too, like with employment numbers being and financial numbers being sort of askew, are folks keeping up with their PrEP? Are they accessing their appropriate harm reduction resources in ways that make sense for them, or are they kind of pushing it to the wayside more so now? Are you having a hard time getting as many people to keep up with PrEP and things of that nature? And for folks who don't know, PrEP is pre-exposure prophylaxis. It's a pill that people take as part of a daily regimen to prevent transmitting HIV.
I've seen more people are, at first people were saying that they weren't worried about taking PrEP, not taking PrEP, but a lot of people will, when the quarantine first happened, they were just like, I'm not having sex, there's no need for me to renew this prescription. But then we did see an uptake in people who were interested in PrEP during the summer, which is fine. It's actually, I think, easier right now for me to get somebody on PrEP. But I think the higher problem we're having here on Staten Island is that Staten Island is always a forgotten borough, unfortunately. We do have lower amounts of things, access to things. So the clinics are all that are across Staten Island are submerged in COVID-19 cases and COVID-19 testing. So if I want somebody to just get an STI test, if I need somebody to get treated here on Staten Island, it's very hard. We have a clinic that we normally use, but then they have to have a telehealth visit. A lot of people, especially Black and brown people, do not know what telehealth is. And then once they figure out, they're like, I'm not just gonna answer the phone call. I wanna be seen in person. We've tried to send clients to CityMD, and literally CityMD has turned our clients away because they're so focused on testing that this person, they're like, we don't have time for you to get tested for STIs, even if you're already showing symptoms. Thankfully, that the New York City Department of Health does have a hotline that where a nurse answers, and they even send, if they can, certain prescriptions out to the pharmacy for you, but it's still something different. It's still something people have to wait for. They have to get a call back for. So because of the limited resources, every other borough in New York City has a sexual health clinic. Staten Island is the only one that does not have it. So it's put in on these already overburdened community clinics or the Staten Island University Hospital or Rumsey. If you're a young Black queer person, I know you don't want to go sit in the emergency room just to get tested for possible gonorrhea, even if you're on fire. So and pay an ER bill if you do have insurance.
Right. And expose yourself to COVID
exposure
to
COVID. Like just sit there, hopefully with a mask. So it has made that harder.
No,
that's definitely a lot of impact that it's not being spoken, like you said, it's not being spoken about a lot because all eyes and all focus right now is on, obviously so, we have a global pandemic and we're trying to nip it as far in the bud as we can and get people back into the world as best as we can under this new normal. But we can't neglect the concerns and conditions that already existed and it was already heavily impacting not only the LGBTQ community, but the intersectionality of the BIPOC community, Black and Indigenous people of color. So this is just compounding and making more detriments for how people can get access, get care, or feel that they can even get care. So it's the stigma aspect of trying to get care. It's the fear aspect of trying to get care. And it's like, oh, that's just on a regular day. Now, by the way, take this new thing you don't know and put it in your arm. Which is speaking highly to our community with the hesitancy. And I thank you for bringing this information and bringing these narratives forward for us so that we can have further conversations and be more connected, especially as Staten Islanders, on how we can kind of shift it a bit so that we can get some eyes and focus back on the other health concerns that are already impacting this community. I'm going to put my questions together. I have two. Specific to your experience with getting the vaccine. Before getting the vaccine, did you have any doubt or hesitation in your mind? And from that question, I also have, what was the timeline when you got your vaccines, like your first date and your second date? And which one did you get? From Moderna?
So I'll start with the first part of the question. Before getting the vaccine, I was hesitant. I'm not gonna lie, I'm very proud to have a Black female doctor. And the first time I talked to her about it, she even said, she's like, oh, I think I'll wait for the second one. And I was like, I just want about it. I was like, what? You told me to wait for the second one, the second round of doses? I was like, no, this is gonna have to be a personal thought. And then like I said before, I had a number of just different health issues. And a lot of them, like I'm open about my blood pressure. As a Black man, I had to take all my blood pressure because I was becoming another statistic. And even part of my work in HIV is the fact that I want people in my community to be less of a statistic. So I took hold of that. And I also, about 2 years ago, tested positive for skin cancer. So I've had a number of things in my life where I was like, you know what? I'm going to try and be as proactive for the first time about something in my life. Like, I'm just going to try and get on this. And then they offered me the shot at my job. And to be quite honest, it went from like, hey, would you like it, to like, okay, it's happening this Friday or this Tuesday. And I was like, whoa, I thought I would have more time in between to think about this. And then I actually rescheduled it for a couple more days because I just kind of wanted to feel more comfortable with my decision. I almost felt like, I hate to say this, but I was like, I think the white man's pushing me into this shot. I was like, for the second, I was like, it's happening too fast. It went from like me thinking about it on Monday to like, hey, we schedule you for Tuesday or Wednesday. And then I read up more about it and actually did some, for the first time, going on YouTube and listened to I think like just people who were Black people who were in the community who were actually doctors, like people, there was some Howard University talks. There were some talks with people from the CDC that were directed at people of color about the vaccine in different talks. And I was like, you know what, I'm gonna do this. And so I think I got that done, I wanna say on February, January of probably like 7th or 8th. And then I got the second shot on the 5th. The second shot I was actually more nervous about than the first shot because all of my coworkers who got the first shot on the second shot, actually, a lot of them got fevers. They got fevers. They were out the whole next day. If anybody in my life knows me, if you're on here, you know, I go to the gym. I'm really about my workout. I'm crashing at the gym. I'm like, I might be out for the whole weekend. I don't know what my life is going to be right now. But luckily I got the shot. And I actually felt pretty okay the whole time. My arm just hurt a little bit more. After I got the first shot, I was a little tired, but that was about it. So that was really my experience. Right now, you know, every day I think my nose hurt a little bit. I was like, there go the side effects. I think that's the side effects coming.
I still see 2 ears, so I so far the zombiness has not happened, which is making me feel a lot better.
No desire to eat brains. You're doing great.
You're doing great.
You know, so that was my experience.
Okay. So Anthony, you've been very patient, I'm sure. So I want to give you an opportunity to share your experiences, but as well speak to your hesitancies to getting vaccinated.
Sure. So, hi everybody. My name is Anthony. My pronouns are he, him, his. I'm a heterosexual man. So me, honestly, I haven't had the chance to get a vaccine yet, and for as many people, one main reason was for me not getting a vaccine is because I was scared. As Nick said, we fooled around saying, you know, someone's going to turn into a zombie with this vaccine, as well as not getting the same outreach if I would have got from someone who I could relate to. And I feel like that's what was a major thing that scared me. And how Nick said he was watching videos of doctors who he could relate to, it seemed like he felt more comfortable. Right now, what we were doing that I've been doing lately is doing testing and tracing outreach with other organizations such as La Colmena, where I'm as a Hispanic showing outreach and giving out information about where you could get tested and how you could get tested. And with that, it boosted more of our community to be like more alert and felt more educated. Like, wow, you know, I have someone who I can relate to, and they're honestly talking in my language, and you know, at least explain to us, like, you know, they're trying to help us as well. As well, the other thing that scared me, like the second vaccine, the second round, like a lot of people did get sick, but after a while, that's just like with every other vaccine, you're gonna feel side effects at first, but you have to get your body used to it, which is fine for it. And right now, I was hesitant to get it, but I'm right now with all this information I'm getting today and that I got from before, I feel like I'm more confident on receiving the shot now than I was before. And that's pretty much my experience with having gotten it yet, but still planning on getting it.
Well, thank you so much. I have some questions for you. I know we heard your bio earlier, but just as to be clear on who you are, if you wouldn't mind, how do you identify?
Sure. So I'm a heterosexual man. My pronouns are he and his. My name is Anthony. I'm from Price Staten Island, the HIV testing specialist.
Yes, thank you. And for the information that because you work closely with, like you said, giving out this information, making sure that this being distributed, especially amongst the Hispanic community, how has it actually come to you that you started to realize, like, okay, so when my number comes up, I should be like, all right, let me hurry up and sit on the website and keep clicking the button until I finally get an appointment through, as opposed to being like, nah, I'll wait, maybe September might be better. If you could speak to that.
So how can I say this one? After I saw Nicholas, like, you know, take that vaccine and everything, I saw he was fine. That's when, like, I pretty much was like, okay, you know what, now it's just not, like he said, let's not be another statistic and wait. And why not just be the ones to put the foot first and be like, be the example of us, you know, we're taking it too. So, you know, you shouldn't be afraid as well. So.
That makes total sense. Arthur, did you have something that you wanted to also add?
So, I mean, when it came, so seeing Nick's example, I can understand. Was there any other sort of weighing in that you did to sort of say to yourself, all right, it's time to make that decision? I know just from working with you that you have a big family, and
yes,
did that play a role in this as well?
Yeah, so that played a major key in my household as well. During the pandemic, actually, some of my family members got sick due to COVID, and the only one that hasn't got sick is my grandma. And what we usually do is like every weekend, me and my cousins and my uncles and aunts go to her house, and before we go, we always make sure we get tested to make sure she doesn't get sick because she's already at an elder age where if she could get sick, something could happen. And this is just one thing that's, it's going to help me to be able to go close to my grandma. I should give her a hug and, be with her and be like, I got a vaccine, it's not going to affect you in any way or anything like that.
Manny, did you want to ask a question?
Yes, I'm about to unmute now. And if I think it's safe that we're moving into the Q&A part. So if you haven't looked into the chat, please, if you'd like to ask a question, you could just raise your hand. You could drop your question directly into the chat, and we'll be more than happy to give you the floor.
Yeah, so I see that Manny has raised his hand.
Manny, before you speak, I just want to agree with Anthony. I have a grandmother, and it turned into a lot of the time because if I was to go out somewhere, I would try and quarantine for 14 days before seeing her. So it's important to me to make sure that she is still, that we're still able to help her because she is getting to an elder age without her being possibly infected.
I do want to remind folks that from what we understand of the vaccine currently, though, that even though the vaccine protects you from infection, it does not stop your ability to transmit, unfortunately. So when we mention our older relatives, we do want to encourage them or have conversations with them as well to get vaccinated, even though I'm sure they have their own trepidations that come from lived experience if they haven't already been vaccinated.
My grandmother's living off of ginger tea. She may get vaccinated, but she's been boiling that ginger root ever since. That Honduran ginger root. As soon as that hits right here, it clears out everything. You got a little Vicks vapor rub.
I said lived experience. I didn't say Granny was going to get vaccinated. I said I knew she might not.
Understood. And thank you, Manny. Your question?
Yes.
Yes, hi. I actually have a question for Anthony. Well, first off, thank you, Anthony, for your continued work in outreach, both virtually and in person, especially during this time. So I have a two-part question. So my first question is, when you conduct outreach in person or even in virtually, so talking to many different people in Staten Island, what is the overall opinion when you talk about the vaccine to them? And is there any differences that you see between groups such as older people versus younger people?
I feel like right now it was like the younger population when I went to do outreach, like they really weren't focused or interested in receiving the test. So they're like, it's not affecting our age group. But like I said, you just never know. Like it's better off to be tested than affecting someone else around you. But besides that, was pretty much the main focus. Like not everyone's aware and think that they can just get it just like that, just because of the age group. They don't fall into different categories that it's on a high risk level of catching it.
Thank you. And then my second question is, when you discuss the vaccine to people who are pretty nervous about taking the vaccine, is there certain ways that you have in order to reduce their fears of the vaccine?
Like for me, like I said, it was seeing like my coworkers and like others who got the vaccine, and that just gave me like confidence. Like, okay, if they could do it, then I could do it too.
Thank you.
And I think it's important to remind folks that this decision isn't a forever decision, right? So if you decide that you don't want to get vaccinated today, you have the absolute right to change your mind about that. As Anthony does, other people have done, because, we learn more, we see other folks responding, we see people in our community doing well. So I think it's important to remind folks that you can decide today that this is not for you and then change that opinion.
And although we were focusing more on the male side today, I will add my voice to say that you both have really helped me feel a lot better, especially hearing that, Anthony, you were moving away from being very hesitant to like, okay, and as soon as they give me an opportunity, I'm going for it. And you, Nicholas, making it clear that you were like, I got a lot going on, but you know what? All right, here I go. And to do it so early on and being one of our frontline people that walked in and was like, yes, stick me with this needle. It's helped me a lot to determine that my extreme hesitancy has tapered a bit so that I feel more confident and more comfortable that when my opportunity does come up, I will be able to sit on the website, smash that button until I finally get an appointment date, or go through one of the wonderful sources and resources that are available to us through our work here and with our partners across Staten Island. But there was something that was also important in my decision, that depending on when my time comes up, I am married. So being married, I don't want to be on top of my partner when they get vaccinated. So because we have young children, so that's something that I keep heavily in mind. So I'm no longer hesitant. I'm waiting, and I would rather my partner go first, and then after that, I will be able to go, because in case their second shot doesn't go, has little side effects to it. You want to be able to take care of everyone, and if it's me, I want to make sure I get taken care of. So I thank you both very much in giving your voice and raising it up for us this evening.
Asia, I want to thank you for just saying that. And like you said, I know this is directed more at BIPOC men, but I always think about my Black and brown sisters and how much everything else is important in the world to them and protecting everybody else. And sometimes it just doesn't happen where they protect themselves. I can tell even from HIV testing, a lot of the time, Black and brown women will schedule. They're like, hey, I want to come in and get tested, but they're like, oh, I have to do this. I have to do this. I don't even get out of work till 8 o'clock. I have this child that I have to take care of. And especially now with parents, if I have to work from home from 9 to 5, teach from home from 9 to 5, try and cook now 3 meals a day instead of cooking the 1 meal a day I may have had because school used to support. When am I going to think about getting vaccinated? When am I going to think about when it's important? So I think there does need to be more of a dialogue directed at, especially Black and brown women, about the importance of taking care of themselves and their family. Just the same way that Black and brown men, especially gay men, should see that. Arthur, I think you know a lot about what happened during the summer where the LGBT community was able to go to, to happy hour, and they lost their damn minds. Excuse my language.
Right.
They lost their minds.
Queer communities across racial identities, it was a uniform mess. You give a mouse a cookie, right? It's going to want more and more. And unfortunately, the sense of freedom that summer provided for a lot of groups, but I can certainly say for queer groups, it was messy. And we want to remind folks that they enjoyed that time so haphazardly that really redrives home why the vaccine can be really important for folks.
Yeah, it can redrive home to people like, hey, it's important for you to do that, then you may want to think about getting vaccinated. The same way it's important enough for you to take PrEP and protect yourself that way, it would be important for you to get a vaccine. But I also know people who will continuously have unprotected sex who unfortunately won't get on PrEP. So there will always be that people who will be like, I'm okay with what I'm doing to protect myself, and I don't need to take the vaccine.
Right, and all we can do is provide information, resources, and access, and hope that people make decisions that make the best sense for them. I also want to just remind folks that even though we are in the question phase of this, I know that usually indicates the end. I did want to share some more information if there aren't other questions.
Yes, please do.
All right, so if there's no other questions, then please feel free to add questions if they come up after this point. So if you decide that getting vaccinated makes sense for you, we wanted to drive home some reminders of how to access that based on what we provided today. All the links I'm going to talk about now will be emailed to you with the email you registered to join us tonight with. Where you can get vaccinated, the New York City Health and Hospitals website provides access to vaccination locations in your area. You want to make an appointment online at any of these access locations. So if when you go to look for your location, it says there's no appointment, as Asia pointed out, you want to just keep hitting refresh because appointments open up. You may want to call offices of the providers that you're trying to access, because sometimes they may have waiting lists running for that day because people do miss appointments. Certainly, if folks are 75 years and older or an essential worker and you're eligible to do so, please make that appointment. And if you're having trouble accessing these websites, please reach out to any staff here. We will be glad to help you figure that out. If you are in a place of hesitancy, even as you listen to Nicholas and Anthony and others speak tonight, talk to people in your community to hear why they may have received the vaccine. Don't be afraid to ask questions. I have seen firsthand in the world that I live in, people are very forthcoming about their vaccination and more than willing to talk to you about why they got vaccinated, what that experience was like. I found that most folks are pretty open and honest about it. So ask questions about vaccines with your healthcare professional. Maybe you see a specialist, maybe your general practitioner, whomever makes sense for you to ask and see what makes sense for you. This is a personal decision, right? You have to make, it has to make sense for you and your lifestyle. And as always, you can reach out to the Test and Trace Corps, which is one of the services of New York City Health and Hospitals. And that information is also on their website, which we'll be sharing. The internet is your friend often, but is also rich with information that can be confusing and confounding. So it is always important to take what you find on the internet and then turn it into conversations with your trusted healthcare professional. As you're surfing for vaccine information, consider guidance from these reputable sources: the CDC, the Center for Disease Control, the Immunization Action Coalition, which suggests some questions you should ask externally, the National Network of Immunization Information, which again, we'll be sharing all of this with you. It suggests questions to ask when evaluating your information. The University of California, San Francisco's Evaluating Health Information page has red flags every consumer needs to know. And the Medical Library Association translates medical jargon, right, medical talk, which many of us get very weighed down by, into language you can understand. And we will be providing these with you to play around with and try out and read and educate yourself as you see fit. We thank you so much for joining us. We certainly thank and lift up the voices of Anthony and Nicholas for being with us this evening. Our website has a COVID-19 page dedicated to keeping resources up to date. We also have videos of previous town halls and information as we receive it. We are partnered with the Test and Trace course in New York City. So as they provide information, we share it. We have a town hall page that, again, brings you back to all the previous information that we provided throughout the time, but it's always recommended to keep coming to our town halls because information changes on the daily. And then this is just, again, we'll be sharing all this with everyone who's registered, but just our general resources for services we provide and partnered organizations provide. Our next town hall will be March 15th. And during that time, we'll be discussing the impact and support needed within the Latinx community. And of course, providing updates on COVID and vaccines as it becomes available. And what I've learned from month to month is that these change significantly.
Yes, they absolutely do, Arthur. And I, again, thank you all for joining us this evening for our monthly town hall. I hope that you were able to get some furthered information on if you were waiting patiently to get become about a group that can have the vaccine done, that you are more excited and ready as soon as your number comes up to go ahead and do it. For those who are a little hesitant before, I hope these voices tonight has helped you to move a little further and closer to wanting to be vaccinated. And if you still aren't sure, the resources that we were going to be sending to you, as well as the voices that you heard tonight, hopefully will help move you into a space that you then feel comfortable doing so. But more importantly, if you decide not to get vaccinated, or if you decide to get vaccinated, it does not make you immune from being a person who can be a carrier, a symptomatic person who can transfer COVID-19 to somebody else. So we still must be safe. So please, please, please keep that in mind and make sure that you're keeping your mask, keeping your distance, and keeping your hands absolutely clean. And I want to thank my colleague, Arthur Charles, for again facilitating another wonderful town hall for us this evening. If you, anytime you have any questions, you can always reach out to us at the Pride Center of Staten Island. And I hope you have a wonderful and restful evening. Be well.